Munchausen's syndrome, also known as factitious disorder imposed on self, is a psychological disorder in which a person intentionally produces or exaggerates symptoms of illness or injury to assume the sick role. This condition is characterized by a deep-seated need for attention and sympathy, often leading individuals to seek frequent medical care or undergo unnecessary medical procedures. Key features of Munchausen's syndrome: intentional fabrication. The person deliberately creates or exaggerates symptoms of illness. Unlike malingering, where symptoms are produced for external gains such as financial compensation, the primary motivation in Munchausen's syndrome is to gain attention and sympathy. Chronic nature. The behavior is often long-standing, with individuals frequently changing doctors or medical facilities to avoid detection and continue receiving attention. Deceptive behavior. Individuals with Munchausen's syndrome often go to great lengths to deceive healthcare professionals, including falsifying medical history, tampering with medical tests, or self-harming to induce symptoms. Symptoms and behaviors: faking symptoms. Deliberately presenting symptoms such as pain, bleeding, or gastrointestinal issues that are not caused by an actual medical condition. Frequent medical visits. Regularly seeking medical care, often at multiple hospitals or clinics. Inconsistencies. Providing inconsistent or implausible explanations for symptoms and medical history. Willingness to undergo procedures. Agreeing to invasive or risky medical procedures to maintain the sick role or to achieve specific attention. Deterioration of health. Symptoms may worsen despite treatment, often because the individual may be actively manipulating their health status. Causes and risk factors. The exact cause of Munchausen's syndrome is not well understood, but several factors may contribute. Psychological factors. Early life trauma, neglect, or severe emotional disturbances may play a role. Individuals may use illness as a way to cope with or gain control over their lives. Personality disorders. It can be associated with personality disorders, including borderline personality disorder. Need for attention. The deep-seated need for attention and emotional support may drive the behavior. Diagnosis. Diagnosing Munchausen's syndrome can be challenging because individuals with this disorder are skilled at deception and may present themselves convincingly as genuinely ill. Diagnosis often involves detailed medical history, careful evaluation of medical records and histories to identify patterns of behavior consistent with factitious disorder. Clinical assessment. Psychological evaluation to assess the person's mental health, including exploring underlying emotional or psychological issues. Observation of behavior. Noting behaviors such as frequent hospital visits, resistance to treatment, or a pattern of self-harm. Treatment. Treatment for Munchausen's syndrome typically involves addressing the underlying psychological issues and managing the disorder in a way that minimizes harm to the individual and prevents unnecessary medical interventions. Psychotherapy. Cognitive behavioral therapy (CBT) and other forms of psychotherapy can help address the psychological issues underlying the disorder, including improving coping mechanisms and reducing the need for attention-seeking behavior. Psychiatric medication. Medications may be prescribed to address co-occurrent conditions such as depression or anxiety, though there is no specific medication for Munchausen's syndrome itself. Careful medical management. Medical professionals need to balance treating the individual's genuine health concerns while carefully managing their tendency to seek unnecessary treatments or procedures. Challenges and considerations. Maintaining trust. Establishing a therapeutic alliance can be difficult, as individuals with Munchausen's syndrome may be manipulative or resistant to treatment. Avoiding conflict. Careful management is required to avoid conflicts between the patient's need for attention and the need to avoid unnecessary medical interventions. Family support. Engaging family members and providing education about the disorder can be helpful in managing the condition. Prognosis. The prognosis for Munchausen's syndrome varies depending on the individual's willingness to engage in treatment and address underlying psychological issues. Long-term management is often necessary to help individuals achieve and maintain psychological stability and reduce the need for excessive medical attention. Conclusion: Munchausen syndrome is a complex psychological disorder requiring careful diagnosis and management. Treatment focuses on addressing the underlying psychological issues while minimizing harm and unnecessary medical interventions. With appropriate therapy and support, individuals with Munchausen syndrome can work toward healthier ways of coping with their emotional needs. If you have more questions or need additional details on specific aspects of Munchausen syndrome, feel free to ask.